it, we're going to be talking about electronic source data and investigations. And part of the reason we're here today is to talk about the changes that have happened. So we'll talk about the regulatory climate leading to eSource guidance. We're going to look at the 3 tiers of data management. We'll talk about the clinical investigator's responsibilities for eSource, as well as paper source, but also the integrity, the review, the release, processing, retention. What does it all mean? One of my favorite experiences, or least favorite maybe, was doing an audit and asking the investigator, can I please see your 21 CFR Part 11 compliance certificate or evidence of your institution being compliant? And she said, yeah, absolutely. And she walks out of the room, and I hear her in the hallway stopping people as they walk by saying, what is a Part 11 thing? And, you know, again, it's not that I expect everyone to have things memorized at all, but it's always a reminder that the verbs we throw around or the language, titles we throw around, people don't actually know what it means. So in order for our sites to be compliant or for ourselves to be compliant, we have to really understand what is the intent. What is it that we're really looking for? So we'll talk about that as we go through class. We'll also talk about the implications of the guidance on source documentation practices and what is the FDA's expectations. And then what I will also touch on, even though this is an FDA focus, is I will go ahead and touch a little bit on the latest ICH GCP E6 document. So we have that loaded in the background, and I'll talk a little bit about especially one of the new sections that has been added to it. They have a new section on governance or data governance, which is marked as being both sponsor and investigator responsibility. So we'll take a few minutes to look at that as we progress through the materials. So we know that when we talk about source documents, the definition really hasn't changed. In the old days, it was the concept of when pen touches paper. And now it's still the concept of the first place something is entered. But that can still be tricky because, for example, if we do an EKG, that EKG reading is the first place that information is recorded, but then oftentimes it'll also be in a source note or we'll see things on the case report form. But we still have to go back to that original electronic document. In this case, it may either be already uploaded into an electronic system, or it could be something that was paper that was scanned in, or we may also see a mix still of paper and electronic documents. So it gets a little tricky in that regard. The concept still being that these original documents and records are pretty much everything. They're hospital records, clinical office charts, laboratory notes, memos. It can be anything. And if it is scanned in, there's still that sort of concept of, well, is that really the source? And we'll talk about that the FDA doesn't really accept copies of things as source, but once it's scanned in, a lot of institutions do destroy the originals. If they have a policy on that, and it is well documented how they ensure every piece of information is now recorded electronically, the FDA won't love it, but again, it's the intent behind it. Because again, as we progress through the industry, it's very hard to expect everyone to scan things in or have original electronic documents and then keep all this paper in boxes. So we're still in that transition period, even after years of our electronic steps forward. So what the regulations do say, if we, again, go back to the intent, is investigators are required to maintain adequate and accurate case histories that record all observations and other data pertinent to an investigation. And that's for both drug and device, drug being 21 CFR 312 on investigational new drugs and 21 CFR 812 on investigational exemption devices. So regardless of the type of system used, we are still looking to make sure that things are very clear. So we don't really accept shadow charts because shadow charts are often not just a complete copy, they're a summary, they're mixed records. It's what the site thinks is most important. So it doesn't accurately reflect what exists. If the site says, no, you cannot see our electronic records, then certified copies may be reasonably provided. But again, we're looking for, if it's a certified copy, how was it done? Do you have an SOP on that? Can you verify that every single page exists? And it's not necessarily a matter of people copying every single page and numbering it and signing it, but it's some kind of cover statement saying this is how many pages there are. The pages might be numbered, but we can see that it is a complete copy of the record without any alterations, without information missing. So sort of a level setting. Let's talk about a couple key things that are going to come up in today's class. So true or false, electronic source includes paper documents scanned into an electronic database, if we are really calling it electronic source. How about this one? And it's perfectly okay to guess, because that's, again, why we're here, and that's why the FDA keeps putting out guidance documents. False. So data review should be conducted by study coordinators and other investigator designees. They're generally recording the information. But the other issue is that when we look at the guidances, and here's the tricky part, it doesn't actually talk about the designees. So full accountability always falls on the investigator according to the regulations. But I do want to give the caveat. That is what the FDA guidance says. If you look at ICH E6 now, it is the first time that there's really reference of the fact that other people actually work on the studies. So it's really interesting, because when you start to look at the change in the principles that they have here, they've elaborated on them, they've changed the order, they've moved things around. But when they talk about responsibility, it is the acknowledgement that there are other team players, that the investigator may still be the one who's ultimately signing off on things, but that responsibility may be appropriately delegated to individuals who are qualified.